Hello and welcome to this video in the series on integrated pest management, focusing on disease control in cereals. In this episode we're going to think about how much fungicide is needed. Now, it's a key tenet of integrated pest management that any treatment with pesticide should be according to the needs of the crop, but the question is, how much treatment does the crop need? So let's take a look at that. In this video on integrated pest management, we're focusing on the question, how much fungicide is needed? Now, in any pesticide treatment, the legal starting point is to consult the product label, and there's an example label for a fungicide here. And what we can see is that it defines the maximum total dose that can be used in a season, and also defines the maximum individual dose that can be applied at one treatment. In this case, for wheat, 0.8 litres of the fungicide product per hectare. So the question is, do we absolutely need to adhere to this value? Where did this value come from, and have we in fact got scope in some circumstances to use less? So let's start by where this value comes from. And this was described by John Finney from the crop protection industry 30 years ago at what was then the HGCA Homegrown Cereals Authority R&D conference. And he presented a really nice paper, and this was one of his first slides, which shows a dose response curve for a new development fungicide. This is a hypothetical curve from one field trial where a range of doses of the new fungicide measured along the bottom axis in grams per hectare were applied to a field, and then subsequently the disease severity was assessed, and by reference to the untreated severity, that was converted into percentage control. And you can see in this case, the level of control in this hypothetical case was very high. Now, what John Finney pointed out was that if you then repeated that field trial across a range of different fields in different seasons, because of the variability, you would obtain a whole range of different response curves. And he illustrated that something like this. What he then said was that if you want to achieve a certain target level of control, and in this hypothetical example, let's say we want to achieve 90%, and you want to be able to achieve that very repeatably across sites and seasons, then you need to set the labeled dose at a level which will deliver that level of efficacy in, say, 90% of cases. And in this example, that would result in a labeled dose of about 200 grams per hectare. And that then becomes, in consultation with the pesticide regulator, when the product is first approved, the full labeled dose or maximum permitted individual dose that we just saw on the label. Now, I happened to give the next presentation at this conference, and what I pointed out was the implication of this diagram, which is that in one case out of 10, the labeled dose is exactly the dose you need in order to obtain the desired level of control. In one case out of 10, the disease pressure is so extreme that you'd actually quite like to be able to apply a bit more, but you're not permitted to. And in 8 cases out of 10, you could achieve the desired level of control with a lower dose than that specified on the label. And that led to a series of projects with the Homegrown Cereals Authority that then became part of the AHDB, which was originally called Appropriate Fungicide Doses and became what was known as fungicide performance. And I've got an example of data from the fungicide performance trials here, and those trials have continued every year for the past 30 years. So this is recent data. What we can see here are measured dose response curves from field experiments, targeted in this case at Septoria, for products which contain a mixture of active substances and for straights which contain a single active substance. The principles I'm going to talk about apply equally to either. We can see also the curves here are sort of the other way up from those shown by John Finney. We're showing here the real disease percentage data. So in the absence of treatment across the 17 trials, the average disease severity was just below 25%. These trials were done on very disease susceptible varieties and only a single spray was applied. And you can see the data points for the levels of disease at 3/4 dose, half dose and full label dose, and the fitted response curves that we've put through those. So these curves are useful for looking at differences between the performance of products. They're also useful as a way of thinking about how we might adjust the dose according to circumstances. So let's just take a look at what happens if we change different aspects of dose response curves and what that does to the amount of fungicide that's needed. So this is a hypothetical but realistic example of a dose response curve like we've just seen. The bottom curve shows the decreasing amount of disease with increasing dose, and it's a law of diminishing returns as you apply more dose. If we know the disease severity, we know the impact of a unit of disease severity on yield, we know the value of a tonne of wheat, we know the cost of the fungicide. We can then calculate the margin in pounds per hectare of the value of the yield minus the fungicide cost at all those different doses, and that's what's shown in the top curve and the margin data on the axis on the right hand side. And what we can see is as we apply more fungicide, the margin increases substantially because we're controlling disease effectively, and then we reach a peak beyond which the additional costs of fungicides are not compensated for by the additional yield we get from additional disease control, because we're on the plateau of the response curve at the bottom, and the margin then starts to decline if we apply too much. And it was from this that the idea of the appropriate or economically optimum dose arose. What we can then do is say, okay, if we change different aspects of this but keep everything else constant, can we explore what are the things that should cause us to change the dose a lot, and what are the things that should cause us to change the dose perhaps not at all or only a little? And we can explore that in the next set of slides. And again, I should point out these are for illustration, but they're broadly realistic values. So the first thing we can do is we can keep the dose response curve exactly the same and the fungicide cost the same, and vary the value of a tonne of wheat. And we see here on the right hand side, optimistically, a wheat price of £250. This should actually read per tonne. And on the left hand side, a wheat price of £150 per tonne. And we can see, perhaps surprisingly, that the effect of that on the margin curve and hence on the optimum or appropriate dose is actually quite small. It ranges from, in this particular set of examples, just below 3/4 of a dose at £150 a tonne, it only increases to about 0.8 of a dose unit with £100 per tonne increase in grain value. So the optimum is really quite insensitive to grain price. In contrast to that, if we look at the effect of the amount of disease pressure and therefore the severity that would occur in the absence of treatment, so we look at the left-hand side of these charts and just pay attention to the disease severity scale. So we can see on the left-hand side, in the absence of treatment at dose equals 0, disease severity would eventually become 5%, or in the middle chart 15%, or in the right-hand chart 25%. And we can see that has really quite a big impact on the position of the optimum of the margin curve. In the low disease case, we're seeing an optimum dose below half, whereas with untreated severity at 25%, we're actually getting close towards the full label dose being the optimum in this set of illustrative examples. Now, the difficulty with that, of course, is that when we apply the treatment, the crop, or at least the leaves we're treating in the crop, can look quite clean. So in a video on how to protect disease epidemics, we looked at this image. So this is a shoot of wheat around the emergence of the flag leaf. At that point, the upper three leaves typically are going to be showing no disease symptoms. And what we're trying to judge is, if we do nothing, is the untreated severity going to look like that on the left, in which case we need a high dose, or that on the right, in which case we need a substantially lower dose. And there's considerable uncertainty around that judgment. But fortunately, there are ways of reducing that uncertainty and reducing the fungicide need. And this is data which we also saw in a previous video from a whole series of field trials where we looked at the effect of the disease resistance of the variety and the sowing date, in this case on Septoria tritici, and we also superimposed either an untreated in dark blue or a low, medium or high intensity fungicide program. And we can see a number of things from this. First of all, if we grow a more disease-resistant variety and or we sow it later, then the untreated severity gets lower. And we can see the impact of that on the fungicide requirement. So, for example, growing the more disease-resistant variety Graham with a low fungicide input, the orange bar on the far right, actually gives us a similar level of disease as if we'd grown a very disease-susceptible variety, Santiago, and applied a high-intensity fungicide program in light blue. So the effect of non-chemical control methods, in this case variety and sowing date, both reduces the average need for fungicide input and, almost more importantly, it reduces the range of possible future outcomes which lead to the uncertainty, which often lead to applying a bit more fungicide for insurance to insure against a substantial crop loss that would result from an unpredicted high severity epidemic. If we then move on to the next aspect of the dose response, so in this set of examples we've kept everything else constant, but we've changed the curvature of the dose response. So if we look at the response curve on the left-hand side, it's a very shallow response. We therefore have to apply a high dose in order to get effective control and maximize the margin. If we compare that to the dose response on the right-hand side, which has a very steep response curve leading to a plateau with low disease, we can achieve a high level of disease control with a substantially lower dose. And you can get some idea of the shapes of the response curves for different products from the fungicide performance data each year. And lastly, the thing we can change in our model here is what I'm calling the level of uncontrollable disease. So if we look at the chart on the right-hand side, this is a kind of optimal situation where if we apply the optimum dose, we actually achieve very high levels of disease control, where can reduce disease almost to zero. If you contrast that with the dose response curve on the left, we can see that even if we apply a full label dose, we're only controlling or only able to control about 2/3 of the untreated severity. And even if we were allowed to apply a substantially higher dose, we're mathematically close to an asymptote, which means that we could apply a very high dose and still not be able to control that final 1/3 of the disease. And the effect of that is to move the optimum dose a little bit to the left, but you can see the effect of this level of uncontrollable disease is actually pretty small in terms of the impact on the optimum dose. It only moves a little bit between the left-hand example and the right-hand example. So you could take from that, well, we don't really need to worry about this and its sort of practical relevance because it doesn't actually make any difference, but that would actually be missing an important practical point. So let's just go back to a video on when is it most efficient to apply a fungicide, and we looked at this diagram which shows the progression from left to right of infection of a newly emerged leaf or leaf layer. On the left-hand side, let's imagine the flag leaf has just fully emerged. It's then exposed to spores landing on it. If we apply a fungicide when it's just emerged, then we're going to provide really effective protection that will reduce the ability of that spore to cause an infection. If the treatment gets delayed a little bit, then we'll be treating a leaf in which the fungus has already managed to penetrate and has just started to grow. But with a systemic fungicide, we can still eradicate or cure that latent infection and obtain a level of disease control. And then if our spray gets delayed beyond that point, we actually reach a stage where the fungus has grown to such an extent within the leaf that it is going to produce symptoms regardless of whether we treat or not. We can see the effect of that in the fungicide performance data. So the previous curves we looked at were for treatments applied in the protectant situation, where the timing is ideal. In this case, the treatments were applied in a much more challenging situation. The disease pressure was high and there were already latent infections at the time of treatment. And we can see the effect of that on these dose response curves. And there are actually two things going on here. Firstly, the curvature of the response curves tends to go down, so the curves tend to be rather straighter, which would cause us, from what we saw earlier, to suggest that we should increase the dose in order to hit the optimum. But the second thing that's going on is that the asymptote of these curves, the level of uncontrollable disease, has gone up very substantially. And in fact, about half of the disease is uncontrollable. And that would suggest that the dose should be reduced. And those two things trade off against each other, and the overall conclusion is that if you're delayed from treating, for example, due to adverse weather, then it does not actually make sense to increase the dose in order to try to maintain control, counterintuitive as that might seem. So what can we conclude from this? So firstly, it's an important tenet of integrated pest management that any pesticide treatment should be according to need. The maximum individual dose is set by the manufacturer and the regulator to provide robust disease control even under high disease pressure and on a susceptible variety. A lower dose optimizes the margin under lower disease pressure or on disease-resistant varieties. An important caveat to this is that if you choose to reduce the dose below that specified on the label, then you are taking responsibility for the efficacy of that treatment. An important point also is that using an appropriate fungicide dose does not increase the risk of fungicide resistance. There's quite a lot of opinion out there to the contrary, and we'll pick that up in a future video and deal with it in detail. Uncertainty about future disease pressure may justify using a higher dose to provide a degree of insurance, but the need for fungicide is reduced by non-chemical disease control methods, and the uncertainty and the risk of substantial crop losses is also reduced by those methods. And the future uncertainty can be reduced to some extent by the use of disease forecasting. As we've just seen, it is actually not cost effective to increase the dose if the spray timing is too early or too late. And lastly, perhaps a rather obvious point, but if the optimum or appropriate dose is 0, then don't treat. And that could be the case because disease pressure is low and or the variety is very disease resistant, or the growth stage of the crop is at a point which is unlikely to be responsive to disease control. And there's some further reading which would allow you to delve more deeply into some of these topics.